earlier, fetal alcohol spectrum disorder, a lot of behaviors come out of that diagnosis, if you will. That is the real foundation through which we have to support these kids in a subclinical fashion. So that's real critical, because if you don't support the brain, you don't understand the brain neurology, you can't support behaviors, if that makes sense. And so we've created a very unique environment, and whether we live, work, learn, or play, everything that we do is in the context of building healthy relationships. Now, we're really looking at two different major diagnoses, if you will. One is the brain-based differences due to the alcohol exposure, and then the other one would be the attachment disorder. Going back to the brain differences, when the developing brain is assaulted through the placental barrier, which isn't much of a barrier, that developing brain struggles to, when it gets that the alcohol affects it, it really is disruptive and damaging. And so you have these areas of deficits in the developing brain, but then you have these other areas where the brain is trying to compensate, and so you have spikes of brilliance. So what we see is kids in our setting and with these backgrounds who are extremely brilliant. They have areas of genius ability. We think about the different kinds of intelligences, like visual, spatial, musical, verbal, linguistic, numerical intelligence, natural intelligence, all the different intelligences that are out there, probably 12 or 13 different kinds that we can name off. But those areas of brilliance we see in kids, and then they kind of fall off the charts. And another way to think of it is kind of like Swiss cheese. You know, you've got these holes, and where they do well, they do well. They present well. They're very social, charming, engaging, and kids with attachment disorder really struggle in relationship, of course, in building trust and empathy for others and conscious development. And so that's a very challenging population to work with, as you can imagine. So again, we want to create an educational setting that allows these kids to really be hands-on and be interactive with one another in relationships, and to be able to learn in a multifaceted environment. Some of the things that we do, I mean, I could talk about the specific day and what that is. I have to just mention my role is really not that of as a teacher here at Ranch for Kids. I'm the executive director here, but I do find myself very passionate about one particular role as, I guess it's a teacher. I teach a character building class. I get the kids for the first 90 minutes of each day, and it's a privilege to be able to sow into them and add value to their lives and teach them. I guess my primary objective in my character building class would be to help these kids become the best version of themselves possible, to become reach their fullest potential. It's to help them think more accurately, think more clearly, think at a higher level. Boy, that's a challenge with these kids for sure, because you don't learn from people you don't respect, and you don't learn from people that you don't like. And so it takes a lot to really be a prominent influencer in their lives. But I get to come in and teach them and really help them start their day off right, start their day off on a positive way. And I remember back in the days of chemistry, my background's electrical engineering, but I remember back in the days of chemistry, I remember the solution to pollution is dilution. And if you can put enough of the right stuff in, you get good stuff out. And I'm a real believer in probably the most fundamental influencer is input outside of the power of association and the right environment. So I just had to mention that. The character building class is truly my passion outside of which I teach during the school year, outside of the financial literacy class that I teach during the summer months. But anyway, outside of that, I wanted to mention that the fact that, we are a Christian-based organization, so we offer a lot of biblical teachings and related classes. We use we use the switched on schoolhouse type of curriculum, Alpha Omega. We use a variety of other resources, Khan Academy's great, history documentaries, different news outlets, DVDs, history, different topics, constitutional series. I could go on and on about that. But we also teach our basics, of course. But I want to talk more about what are the things we do outside of the classroom rather than just within the classroom. Yes, in the classroom the kids are going to be doing group instruction. They're also going to be having individualized instruction on their individual laptops, and it's CD based. They're not online, they don't have internet connectivity in this setting. But those are the individual switched on schoolhouse curriculums that are pretty comprehensive. But outside of the classroom is really where a lot of learning takes place. For instance, our kids have art therapy. They do art weekly, and they produce magnificent creative works and get to expound in that area. We do carpentry classes, woodworking, and it's amazing the kind of things they create and develop. We also do a lot of athletic type things. Kids got to run, they got to move, so PE and sports and those sorts of things. We do community service and work projects and a lot of learning involved in many of those hands-on construction type projects and whatnot, ranch work and whatnot. So one area that I want to highlight, though, as we conclude with this topic is what is probably the most favorite class that the boys and girls have, and that is our Equine Assisted Therapy program. Basically our Equine Assisted Psychotherapy is what we call natural lifemanship, and we use horses as a very powerful tool to help our kids connect with one another, but more importantly connect with the horses and develop healthy relationships. Now, our natural lifemanship is a very powerful model, just like our other models, like the MANT system and TBRI models and different things like that. But again, the goal of natural lifemanship would be the same goal as the MANT system, to build healthy, connected, attuned relationships. And so using horses, we can embrace direct and indirect connection and feel. We can learn relationship logic principles. I guess one of the ways I can describe that, and I teach it to our team, is there are three things that we do in relationships when we make requests in relationship. We can ignore the request, we can resist it, or we can cooperate. So the way I put it is ignore, increase, resist, remain, decrease when right, or go insane. And we're talking about pressure release. So if someone is ignoring you, increase pressure. And if they're resisting you, maintain pressure, and then when they cooperate, you release pressure. Horses, brain neurology, brain-brain connections, the limbic brain to limbic brain, all those things apply. Again, it's principle-based training, just like MANT. It's principle-based and people-centered. In this case, it's focused around using horses as a very powerful tool to learn how to self-regulate. So when we talk about regulation, we're talking about bottom-up as well as top-down regulation, cross-brain connections. The work that we do here is really about healing the brain trauma. These kids suffer from really the effects of a disrupted normal neurological development because of their trauma. That's what trauma does. And so we have the challenging task to help the brain heal. And it's a mental brain gym, if you will, in this environment. And so we use rhythmic riding to heal that brain trauma. There are many facets of the natural lifemanship, equine assisted psychotherapy, that are quite effective. And I'll just say this as I finish up. All of our models use what is called a trauma-informed approach, trauma-informed care model. And if you don't understand trauma, and you don't understand brain neurology, you're going to really struggle with providing effective therapeutic treatment. And I'll say this as well. If you recognize the FASD brain or that particular population, most therapies, cognitive type behavioral therapies, maybe even some dialectic behavioral therapies, CBT, DBT, unfortunately, our kids are here because those were not as effective for them. In other words, those are targeting more the wizard brain, not the lizard brain, and our kids are pretty much in the survival part of their brain that has been muscled up, and certainly in the limbic part of their brain. So access to the higher brain regions, the subcortex and the neocortex, those are going to be harder for us, our kids. Those neurological pathways are I like to say they're kind of like goat trails. They need to be superhighways. They're superhighways between their emotional brain and their brainstem, their fight or flight brain. They've muscled that up real well, and they're real good at running that neurological pathway, but they're not real good at running the neurological pathway of someone going between their emotional brain and their higher brain. So that's the nature of our kids. That's the nature of their neurology, and of course their biology and their behaviors stem as a result.
So we could kind of sum up by saying these children do have special needs for well-rounded approach to achieve a sense of security, to learn about how to just be a person, their best person, the person they would like to be, and with the highest moral values, with social skills, with relationship capacity, all of these things you are giving to these children, you and your staff and your facility here, your ranch environment. It's just wonderful, Bill. So thank you so much for what you're doing, and also for taking time to share what you're doing with the public. And let's talk again in a short.